Hello everyone, this side Dr. Manjit Kumar, Faculty of Paramedical Science, Department of Physiotherapy, Rama University, Kanpur, UP, India. So today in this video, I will be talking about the muscular dystrophy, which is the main conditions that I have found in the society mostly. So which condition this is most prevalence in society, in community, it is need to have manage it properly as early as possible. So here we can say protection or prevention is more important than cure, because as we know that, and I will be talking about in this video lecture, that this conditions actually cannot be cured properly. So here is only the option we can manage these conditions as early as possible, and actually this is condition which is ongoing process, because always there is a muscles loss, that is progressive muscular disease. That's why it is called as muscular dystrophy. Dystrophy in the sense there is a destruction of muscles. Destruction of muscles, in that sense we can say there is a not making of the protein. So protein destruction may lead to the muscle loss. So muscle loss is there, that's why it is called as muscle dystrophy, means deteriorations of muscle mass. So we will start with this with the intro. So what is this condition? Actually in this condition mostly we found it is genetic disorders where it is always a ongoing process, means it has the progressive course and there is a continuous muscular weakness, and these conditions can be found at all ages. But mostly it has been seen that it is found in child, but not others can be excluded, because it can be at the birth, it can be in 20s decades, or it can be after that. So it is along with that, because as I have already said that it is the protein destruction. So on this basis this condition can be classified into 4 to 5 types. So first one is mostly and most common, that is Duchenne muscular dystrophy. Another one is Baker muscular dystrophy, and next one is myotonic muscular dystrophy. Another one is facioscapulohumeral dystrophy. Another one is congenital muscular dystrophy, and last one is that is limb girdle muscular dystrophy. So these are the 6 or 7 variant of these conditions. So what happens if we focus on mostly there is a availability of or prevalence of most available condition is muscular dystrophy, means the one variant which is Duchenne muscular dystrophy, and another one is Baker dystrophy. These two are most common in community. So we talk about the now what is the cause behind it. When we consider these things, so there is a main important thing, that is genetic mutation. Genetic mutation is that reason which causes the destruction of the enzyme. Enzyme destruction, it is the most important factor that may lead to destructions of the muscle, and these muscles may lead to weakness and loss of balance, frequency of falling and like that, or abnormal gait, there is a scoliosis, there is a contracture. So loss number of complications we can found in these conditions. After that there is a risk factor. So main important risk factor is family history. If there is any case which is associated with this family, so more chances they get these conditions. In family history mostly what happens, there is a genetic mutation, no doubt it this condition can be found in both kind of sexes, means male and female. However, male is more affected than female. No doubt, female girls can carry these conditions, but male is more affected. So we talk about the another complications. What could be the result after these conditions if patient have? So they may be like this. There is a breathing problems, there is a swallowing problems, because already as I have told you, because there is a loss of muscle mass, means muscular weakness is there, or that is progressive. Another factor is important. So here we can found the contracture, because there is no muscular balance bilaterally, and there is a increased risk of fall, there is a decrease in balance, and another is muscular pain is also there. Along with that, there should be foot drop, there may be tightness of heel cord, spine may be deviated, that is called as scoliosis. So for these complications, what is the our strategy to manage these conditions? So while talking about the management, so first we need to have an investigation. Without proper investigations of any conditions, we cannot manage these conditions properly. So investigations include first, if we talking about any neurological condition, that is 100% chance, that is there should be always first and foremost thing, that is physical examination, and physical examination always starts with the history. So history is the main important component to manage the complications. So first one is history and physical examination. Another one is, actually we know, because there is a involvement of dystrophin enzyme, destruction of enzyme, that will lead to protein destruction. So that's the reason we need enzyme testing. And if we want to differentiate what kind of muscular disease is there, because there is a 6 or 7 variants are there, so we need to have a decide that which one is affected, which one is in the scene. So in that scenario, we have to need a biopsy. Biopsy have ability to distinguish the muscular dystrophy conditions, which variant is there, that is confirmed by the biopsy. And because as we know that number of complications is there, that may lead to hearts, lungs, swelling, breathing problems, that's why we need to ECG as well. On the basis of ECG, we can find what is the problem in the heart in the sense of muscular thickness, because as we know that heart also it has muscular strength. If there is reduction in muscular strength, definitely there will be problem. So and that problem may lead to arrhythmia. So if we want to manage these things, definitely there is a need of ECG. Next, so what will be the next step for this? There is a plan of care, how to plan, how to care these conditions. So to do that, first we have to do, that is we have to manage these conditions. So where we have to focus on what things we supposed to manage as early as possible, or in the continuous process, because it is an ongoing process. So for ongoing process, we need process in terms of treatment or plan of care. So we will focus on the strength, balance, muscles flexibility, range of motion, pain, and last one is stiffness. So these kind of things we have to manage. For this, we need management, how to manage. So first and foremost word or component is that there is no cure. It means always we have to focus on prevention. Always during the course of disease, we have to manage all things as maximum as possible. Next, for this we need multidisciplinary approach. This means that we need surgeon, we need medical treatment, we need physiotherapist, we need occupational therapist, we need speech therapist, etc. We need even psychological management as well. So there are management for this medicine, physiotherapy and surgery. While talking about the medicine, first component, that is the conservative treatment, comes under the category of it. So first one medicine focus is, first one is corticosteroid like prednisolone. Another one is golodirsen. Another one is anti-inflammatory drugs, or we can use here Primacort. Like these are the medicine which is helpful to cover up the flare of the conditions, but still there is a no cure. And while we talking about the physiotherapy, that will be in the following process, we will discuss in detail, and surgery, that is for the complications. Even normal contracture, if contracture is not managed by the physiotherapy treatment, that there is a need of surgery. So what is the physiotherapy treatments? Physiotherapy treatments, first and foremost important thing is, because as we know in physiotherapy we focus on the exercise. So first component is, which is most important, that need to consider always and always, that is optimal stress. When we going to give exercises, when we going to manage the strength, balance, we always go with the progressive muscle force according to muscular conditions. It never should be more than the conditions can bear it. So there is a need of balance training, because there is a loss of muscles, so there is a loss of balance. So we need to have a balance training. Next, we need to have a gait training. We will focus on the posture training. We will focus on the positioning, because there is a chances of getting contractures. So that's why it is most important. Another one is how to contracture can be managed. So most management in the category of the conservative treatments is splinting. Another one is home exercise program that patient will follow in her home, and flexibility training is important. On the basis of muscular flexibility can be maintained, and patient can be dependent if possible. It depends on the condition as well. And last, we have to focus on the follow up. It is very important. Every patient need to follow up the doctor's physiotherapist whatever it needed. So this is the all about the muscular dystrophy. Thank you so much. I think you have learned sufficient enough, or I hope it could be beneficial or eye-opening, eye-catching video lecture for you. Thank you so much. Thanks a lot.